Okay, good afternoon, everyone. My name is Delaney Calagiros. I am the Manager of Strategic Talent Acquisition here at Sinai Health. And we're gathered here today for a information session on medical laboratory science. And I'm joined by my colleagues, which we'll get to do an introduction shortly. And thank you very much for attending. We may see some attendees come through whilst we're presenting. And so what I wanted to just start off with is if you do have questions, please feel free to put them in the chat. We'll get to them at the very end of the presentation. And if you do happen to hop off the call, we certainly will ask that you, and I'm going to ask Ben to put that in the chat right now. We have future.careers@sinaihealth.ca, which you can actually share your question if you do have to leave. So again, we will begin our presentation, and I'm just going to share my screen right now. So to get right into our session today, presenters, myself, I did my quick introduction. We do have Kathy Yates, and I'm going to ask Kathy as well as Darlene Collette to come on mute and to do an introduction before we begin our presentation. Thank you. Kathy?
Hi, my name is Kathy Yates. I'm the Senior Manager for the Core Lab. The Core Lab consists of biochemistry, hematology, transfusion medicine, and I also have a specimen management area.
Great, thank you very much, Kathy. Darlene?
Hi, I'm Darlene Collette. I'm the Senior Manager of Anatomic Pathology, which includes histology and cytology.
Thank you, Darlene. And we have Ben. Ben, if you want to come off mute and you can do an intro.
Hi, everyone. My name is Ben. I'm the Digital Marketing Specialist on the Workforce Planning team, and today I'll be managing the chat. So if you have any questions that Delaney mentioned, use the chat feature, and I'll read them out loud at the final 15 minutes of this presentation.
Thank you, Ben. Going into today's agenda, we have an introduction to Sinai Health and our campus sites, but more importantly, we have a department spotlight on Core Lab, and then we have a department spotlight on anatomic pathology, and then we'll get into some current vacancies as well as the candidate experience, some tips that would probably be very valuable to you as a candidate coming through our recruitment hiring process, and of course, we'll save some time at the end for Q&A. So to get right into our presentation, Sinai Health is comprised of Mount Sinai Hospital. We are right down on University Avenue, 600 University Avenue, known for acute care. It's a teaching hospital as well. We also have Hennick Bridgepoint Hospital, recently rebranded and renamed to Hennick Bridgepoint Hospital, known to be at Broadview and Girard. If you're very familiar with the Don Valley Parkway and you take a look up, you will see the Hennick Bridgepoint Hospital very modernized, I should say, in terms of the look, as well as the feel of the building, and it's known for complex and rehabilitative care, also a teaching hospital. And then we have Circle of Care, which is known for home and community care, as well as we have our research powerhouse, which is the Lunenfeld-Tannenbaum Research Institute. And we've seen patients who've gone through Mount Sinai Hospital, gone through Hennick Bridgepoint Hospital for rehabilitation, and then engaging in Circle of Care for home care as well. So why choose Sinai Health as an employer? Well, we certainly make an impact on lives of others. You know, patients and their families are at the center of everything that we do. So whether it be, in the front line, support or research, all employees play a vital role in helping out patients and their families. Certainly, you have exposure to various career outlets and opportunities, a wide range of career paths that you can pursue. And of course, we have the reputation and leadership in healthcare, access to influential healthcare professionals. We're known for excellence in so many different specializations, from genetic research, surgery and oncology, women and infants health, diabetes, critical care, cardiology, and the list goes on. So certainly you can go onto our website to review some of the interesting facts in terms of our leadership team, our clinical, I would say, accomplishments throughout the various years and the different specializations. Department Spotlight, I want to feature Core Lab here, and I'm going to ask Kathy to unmute and to give us some insights, and just let me know when to move on to the next slide.
Okay. Hi, so as I said in my introduction, I oversee the core lab and we have 4 major departments. And of course, within each department, we have some subsections. So in biochemistry, the main area of biochemistry is the routine work, but we also have special chemistry where we do protein electrophoresis, we test for vitamin D. We have an area where we do maternal serum screening, and we also have point of care. In hematology, again, routine hematology or CBCs in our coag. We also have a special coag department. We have hemoglobin electrophoresis, we do bone marrows, and we also have a flow cytometry area. In transfusion medicine, it's a department within itself, within its own little area. And we're more, Mount Sinai is known because we do the fetal transfusions and we do have code omegas, which is similar to our massive hemorrhage protocols. And in specimen management, basically it's a specimen receipt and send out. And we are a 24-hour, 7-day-a-week operation. We work every hour of the day, every day of the year. Next. So I wanted to give you a little bit of a tour of our lab. So for biochemistry, as you can see, we have the routine chemistry. It's the automated line. This line is pretty amazing. It starts with the C8100, and it basically takes the chemistry sample, receives it, spins it, aliquots it, moves it onto the analyzer that's going to do the testing. And when it's done, it goes to the very back of the picture where you see a big white wall there, and that's our P501, which is a refrigerator. So it takes the sample from beginning to end. We also have our special chemistry, and you can see where we have protein electrophoresis, and we have an instrument that does the vitamin D. And maternal serum screening, we have our main instrument that does the hormone testing for that. And for point of care, gave a picture of our glucometers, and that's just part of it. There's also urinalysis testing. We have lactate testing also. Next. In hematology, there's our automated CBC line. We're with Sysmex right now. And so we have our 2 analyzers right there that test the CBCs. And at the end of the track is also our slide maker stainer. For our coagulation, we have 2 instruments there with the Sysmex. One is routine and one is for specialized, but we can run on both. Hemoglobin electrophoresis, we're going to be doing an RFP this year, so we have some new and interesting instrumentation coming up, but we currently have the variant. And in flow cytometry, we currently have Beckman Navios, and we have 2 of those instruments. We have a backup for our current one, so that's a great area to be in also. Next. So for transfusion medicine, we do have automation. So we have the OrthoVisions, which is our automated blood bank, but we still do manual bench where we do antibody investigation. And if there's any issues, we can always do a manual blood typing also. Next. And this is a quick picture of specimen management. So a lot of our samples are delivered by the pneumatic tube station, or if it's within the hospital or some of the areas within the general vicinity. And right beside there too, we also have our vestibule where we receive samples from porters and couriers. And the other picture here is the automated system, which was part of our automated chemistry line. You couldn't quite see it in that picture of the biochemistry, but this line here is the samples are put on and they are received, centrifuged, aliquoted, and moved on to the next part of the main line for the biochemistry. So that's pretty cool because we do receive about 5,000 to 10,000 biochemistry samples a day. So to manually receive those would be just a little bit too much of my technicians. Next. So to break it down, just to let you know how the staffing is. So as the core lab manager, as I said, I oversee the 4 main areas. In biochemistry, I do have 2 charge MLTs. I have 3 seniors, and I basically have I have full-time and part-time technologists. In hematology, it's 1 charge with 2 seniors. I have full-time, part-time, and we recently introduced casual. In transfusion medicine, it's a charge technologist, a safety officer, medical technologist, a senior, and I also have full-time, part-time, and casual. And specimen management, I have 1 lead technician and then full-time and part-time. And again, all of our teams are supported by professional staff. So we have 2 biochemists, a hematopathologist, and our transfusion medical director. Next. So to just give you some highlights of the department. So in biochemistry, we do over 2 million tests a year. Many advances, and so basically we're always looking to improve speed, precision, and accuracy, always to support the patient care. It is the most automated department, as you can see with our huge line there, but it allows us to do that much more testing. We're always bringing on new tests, always trying to improve and expand what we're currently doing. And we do a lot of projects. We've been doing a lot of the COVID serology testing, not so much the PCR, which is done in micro, but we've been doing the serology to see the immunology aspect of it. And then in hematology, so it's the hematology and flow, we do about 300,000 tests a year. I am currently anticipating new instrumentation for my CBC line. I'll be in by the end of the month, so it's going to be a lot of validation, a lot of new exciting things happening there. In special coag, do a lot of the tests. We do a lot of the factors. We do lupus. We do von Willebrand's. So that's always bringing on more. Whatever we can do in house, the better. We have our hemoglobin electrophoresis area. Our bone marrows here at Mount Sinai. The technologist actually goes to the bedside. It's not where they send a sample down to us and we do it out of a tube. The technologist goes and works with the nurses and the doctors at the bedside to collect the sample to make sure it's a good sample before bringing it back to the lab and processing. And again, associated with my hematology, I also have my flow department. And that's, once you've been here for a little bit, when opportunities arise, you can apply to work in that area. And that's always up and coming. And then transfusion medicine, we do over 100,000 tests a year. Like I said before, the fetal transfusions are not done everywhere. It's a very specialized because we have a 3-level NICU where, again, they will do fetal intrauterine transfusions. We also do neonatal exchange transfusions and sickle cell exchange transfusions. We have Code Omegas, or massive transfusion hemorrhage program. And we also are the special pregnancy program for Ontario Fetal Center. Next. So for the training, orientation, and education, when you're hired, there's a general orientation for the hospital. And then when you come into the core lab, depending on what department you're hired into, there's a minimum 2 to 3 months of training. You're on day shift. If you're hired for an off shift, once you've signed off your competencies on the days, you'll then shadow for a couple of weeks on the shift that you're going to be hired onto to make sure that you're fully confident and competent for that shift. And again, if you need more time during that time period, you just talk to us and we make sure you're signed off and you are competent before we release you onto the bench. We do have an annual review of e-learning modules, that's hospital-wide. Core Lab currently hosts weekly resilience sessions where we have, staff come up and they go into our hallway and they do their breathing, their stretching, just gives them a few minutes a week just to kind of rebalance themselves. The departments will have their huddles to pass around the information. Emails go out too. I send a lot of information out for emails. And we also have continuing education opportunities. We're currently enrolled with CAP. They have free courses and assessments. And for Core Lab, I do assign 2 a year. And I also let everybody know what is available. So if you have, for your licensing, you need to have so many continuing education courses a year. I can help supply you with some free ones, which helps. And we also have webinars, and hopefully we'll get back to lunch and learns again once COVID restrictions lift. And next. So to be a successful candidate for the Core Lab, again, as a student, if you don't have the experience yet, as long as you've finished your clinical rotations and you've experienced a number of different, different instrumentations, if you're licensed, or we will hire if you're awaiting licensure, at that point you would be hired as a Tech 4, and once you prove your CMLTO license, we retro you back to the time of your license and you become a fully licensed MLT. At that time, again, you just release you don't release patients, but you can be training at that time. We're looking for excellent communication skills. You're working with coworkers, you're working with the other professionals within the hospital, collaborative working relationships. You want to be a good team member. Be open to ideas and feedback. Policies change. We also listen to ideas and see what would work for improvement. Be adaptable to change. The lab does not stay still. Lab life is always evolving. And as I said, we're 24 hours, so you need to be available, for flexible hours. Next.
Okay, so that was very insightful information, Kathy. I really appreciate you sharing all of that valuable information. And certainly if you have questions for Kathy, we do encourage you to put them in the chat right now, or you can wait until we have completed the session, where we'll save some time for the Q&A. So going into our next session, where Darlene will talk about anatomic pathology. Darlene, over to you.
Thank you. So a little bit about our department. We have histopathology, but within histopathology, we're divided up into essentially 4 sections. So we got our surgical pathology, which is gross dissection of the tissues and biopsies that we're receiving from the various ORs and clinics, both within and from outside the hospital. We do autopsy pathology. Mount Sinai specializes in perinatal autopsies. We are one of the few centers in Ontario, and we receive these requests from all over the province. Routine histology. Our routine histology department is growing faster than we can keep up with it. Although there aren't any positions posted right now, they are on the horizon for the very near future. We do our routine histology, which is embedding, microtomy, special stains, and we do muscle biopsies, we do kidney biopsies. So like Kathy's folks that go for the bone marrow to the bedside, we do the kidney biopsies with the radiologist to ensure that we have viable tissue to work with. And we also have immunohistochemistry, which is in itself a subspecialty off of histology, where we are staining with antibodies in an effort to diagnose these specific cancer types and subtypes. Then we have cytopathology, and we do both gynecological and non-gynecological specimens. The gynes would be our pap smears, and we do about 15,000 gyne cases per year. And non-gynecological specimens will be all of the fluid aspirations that come to us from various clinics. Also within cytopathology, we've recently taken on fluorescent in situ hybridization, short form that I'll refer to moving forward as FISH. And within FISH, we do breast and sarcoma cases. Next. So the first picture there is the FISH reading room. Those are specialized fluorescent microscopes where the technologist will look through the microscope and count the fluorescent signals. And that will be a basis for cancer treatment and diagnosis. In the cytology wet lab, if you see that little ring on the table there, that is a ring that all of our PAP vials go into, and there is a machine in the back behind the centrifuge that wheel fits into. It makes our slides for us, then a technician stains the slides and gives it to the cytotechnologist to read and diagnose. Onto histology, we have, of course, embedding. I'm sure all of you have experienced this in school to some degree. We have over 600 cases per day that we embed. So at minimum, there's always 2 people embedding. We have a third embedding station that we use for specialized bone procedures because bones cannot or do not cut well if they're not in a specialized plaque. So we have to keep that separate. And then we have microtomy. Our microtomy stations are in the process right now of being updated. If you see in the on the far back wall, you will see a little blue screen. That is a slide printer that is going to be implemented across all microtomy stations and hooked up into our computer system. So you no longer have to handwrite or label slides. The slide will be printed through this little machine directly from the information coming from our computer system. In the next picture, that's our H&E stainer. It's a high volume capacity, and it's the bread and butter of histology because it's the first thing that pathologists look at for diagnosis and further testing. Then we have immunohistochemistry. The first picture is one of our instruments that we place the slides on with various antibodies and reagents to unmask proteins and produce the staining patterns that the pathologist will diagnose. Along the long bench is where we do all of our QC. So the technologist there is actually looking at the stained slides through the microscope to make sure that the target cells have been stained properly and that our controls have worked properly, and then she signs it out to the pathologist. Recently, we've also taken on some in situ hybridization within that lab, and we now do HPV testing for high-risk subtypes for head and neck and gynecological cancers. Our structure, you have the manager who oversees cytopathology, surgical, autopsy, and histology disciplines. Within surgical pathology and autopsy, we have a senior pathologist assistant, 6 full-time pathologist assistants, 1 casual, 1 part-time technician, and 1 full-time pathologist assistant in autopsy. We also support Women's College Hospital for pathology. So one of the pathologist assistants goes through a rotation, and we always have 1 person at Women's College Hospital. In cytology, we have 1 senior medical technologist. We have 3 staff currently that are cross-trained to do cytology and FISH. And our long-term goal is to have all cytotechnologists trained to do the FISH. It's about a 6-month training time to be able to be signed off on your competencies for FISH. We have full-time, part-time, and casual cytotechnologists and 2 technicians performing the staining in the wet lab. In histology and immunohistochemistry, we have a charge medical laboratory technologist, 2 senior medical laboratory technologists. 1 oversees histology and the other immunohistochemistry. We have 16 full-time medical laboratory technologists and 7 full-time technicians. And all teams are supported by a section head pathologist. Surgical pathology has 1, cytopathology has 1, and histopathology has 1, and immunohistochemistry has another 1. So there are 4 pathologists involved within our routine operations for oversight and information. In histology, we do over 30,000 cases annually. It translates into 120,000 blocks and almost 200,000 slides. So it's a pretty high volume lab. We're serving inpatients, providing technical and professional interpretive consultation for institutions across Canada. So we are a reference center for multiple Cancer Care Ontario supported tests, and we're listed as a reference center with CCO. So we have a lot of institutions from across Ontario and across Canada that send in for this specialized testing. Projects in this department help with quality assurance and answer questions for physicians, researchers, and other internal and external clients. for cytology and fish, we have approximately 15,000 gyne pap tests and 8,000 non-gyne samples that we do testing on annually. We recently incorporated the fish for HER2 breast and sarcoma, and those are approximately 500 cases each annually. And soon to come, and what we're really excited is the validation. Fish extraction right now is currently a manual process. We have the ability to automate it on our immunohistochemistry platform. So you can see how cytology and histology intertwine with each other. And we also do various projects to help support physicians, researchers, and other internal, external clients. And our cytology department holds an annual symposium for cytotechnologists across province. Training, orientation, and education is the same as what Kathy described to you previously. So it's about a 2 to 3 month training schedule, and that's dependent on where you are. For immunohistochemistry and that subspecialty, we generally require experience and a good basis within the histology department before we move you into training there. Support provided for additional learning needs. We do webinars. The vendors put off a lot of webinars. There's recap courses and assessments, webinars, lunch and learns. And a lot of times, a vendor will come in and do a demonstration, new software, new protocol. Another thing that we're growing into, and it's been driven by COVID, is remote histology for the pathologists. So we're on the cutting edge right now of digital pathology. So candidate success, successful clinical rotations with experience, of course, in microtomy and special staining. If you're licensed or you're waiting to be licensed with CMLTO, we will still hire you, as Kathy said, as a technician 4 while you're waiting licensing, and then that becomes retroactive once you do get your registration. We're looking for excellent communication skills because we're communicating across quite a broad range of interprofessional folks. So we're communicating with nurses, with porters, with supply staff, within ourselves and our own disciplines, and with pathologists and physicians and surgeons as they come into the lab. We're open to ideas and feedback. We're always looking to improve, and we're adaptable to change. We're looking at new ways to take histology to a more automated level because it is very manual and hands-on right now. And as new technologies develop and become available, we are looking to adopt those to help make our life a little bit easier and able to work flexible hours. So we are a day shift, Monday to Friday. But with our expansion and our growing volumes, we may have to look at adding an evening shift on there, probably until 10 or 11 p.m. So that will probably come within the next year or so.
So any concluding advice, Darlene, Kathy, if you want to touch on, what really stands out when you review applications that come through, either be it students or even experienced professionals or new grads looking to apply?
Any experience you have on instrumentation is great. If you are good at computers, laboratory information systems, we're always looking for people with that adaptability. And Kathy, you want to add anything?
Yeah, like I say, when I review a resume, I like to see the instruments that you have worked on. So if you have worked on instruments that I have in my lab, sometimes that's a bit of a, because it's a little easier than to train you. You already have, you're already familiar with it. Again, too, like say, list the instruments that you've worked on, list any LAS that you have experience with. It kind of lets us know, where you would stand out from other candidates.
Great, thank you. So current opportunities right now in general duty technologists and core lab, the area is biochemistry. There's a temporary full-time position. As you noted here, we have the job ID number, which is 7419. And we also have a general duty technologist core lab biochemistry, also temporary full-time. And the job ID number is 7180. So I'm going to ask Ben to put in the chat our career website where you can take a good look at these opportunities. Just a sample job posting here on the screen for the general duty technologist 7419. As you can see here, we have the job type, number of vacancies, the department, it's unionized, OPSU, location as well. There's also the hours, and then we actually note how long the duration of the contract is going to be. And we noted here 12 months, as well as we have the responsibilities and the job requirements. And then we have the open and posting deadline date, which is also very important for you to take a note of, making sure that you get your application in on time. The posting does come down at 4 p.m. on the deadline date. And it's also very important to note the current requirements, just to make sure that you've met those requirements and you've highlighted them in your application when sending in your resume. So candidate experience, wanted to kind of give you a little bit of an idea. As I noted, Ben would have put the career website in the chat, but you can also select the campus, and then you can view the job board and filter the search as to what you're looking for in terms of be it a lab technician, a pathology assistant, etc. And you can see the job posting, so please feel free to review. And these postings do come up and down very frequently because we do close positions and we have new ones coming up on a regular basis. Our recruitment process, what does that look like? So we have the job posted. Most times if it's going out externally, it would be posted for 2 weeks to the general public to apply. And then we shortlist candidates once the posting deadline has come through, so that when we shortlist those candidates, we make sure that if we're shortlisting, and we've shared some of that, there's different approaches where we can share it to the hiring manager first before we pre-screen, or as the HR team, we can shortlist and pre-screen who we believe would be suitable to the opportunity to share to the hiring manager. If you are selected for a pre-screen, the pre-screen usually is anywhere between 5 to 15 minutes. Average time would be 10 minutes, where we, make sure that you've met the requirements. You have any questions, needed clarification on the opportunity, which is very important to have that dialogue in the beginning rather than the end of the recruitment process. After we've done the pre-screen, then we'll share them to the hiring manager, as I mentioned earlier. The hiring manager will then determine who they would like to select for an interview. Right now, we are doing most of our interviews virtually due to COVID-19. And that would be done via Zoom. It could be a panel interview, or it could be, and when I say a panel, it could be two to more individuals sitting in on the Zoom call, or it could be the hiring manager and a member of the HR team. If testing applies, there would be a practical assessment. It could be where we've seen that happen in various areas of the hospital. If after that first round of the interview, there is no need for a second round, then we'll make a decision as to who to move forward with. And that's where we will do, references, medical verification for your occupational health clearance, and academic credential verification, making sure that you've, met the requirements, you have provided all your documentation before we can get out a conditional offer. And then, of course, we will send you a final offer in writing for you to review and sign off on. And then you will be enrolled in our orientation program. We have I would say a hospital-wide orientation program. Starting on that day that you are assigned to start on with other individuals similar to you or in a different department altogether, where you learn about Sinai Health, Mount Sinai Hospital. And then you would be enrolled, of course, in your department orientation once you've started. So that is what our recruitment process looks like. If you have any questions, again, please put them in the chat or let us know. You can come right on the screen to ask.